as we have had WHO 2022 right now, so we are a little bit fixed for the upcoming, let's say, 2 or 3 years at least, except if there's some really breaking news in research, of course, which can always happen. Nevertheless, I think that surgical pathology is still a very strong player, especially with the cancer architecture. And I think people will still listen to us when we talk about Gleason scores and cribriform tumors and probably also specific aspects like subtypes and the staging, of course. So I think these are really things which will not disappear within the upcoming 12 months. We have become precise, we have less inter-observer variability, especially in the cribriform setting. So I think this is very important that the urologists and oncologists really consider what we write in the report. Another big topic, I think, is Gleason score 6, because many clinicians say, well, it should be stopped. It's not cancer at all. This is not true. Of course, it is cancer, although it's not a very aggressive type of cancer. But we know very well that sometimes Gleason grade 3 can evolve towards 4 and 5 with an accumulation of mutations and so on. So I would be very, very cautious saying, well, Gleason score 6 is not a cancer. I think it is cancer, and I think really all pathologists will join this opinion. I think genetic testing will be more important, probably based a little bit on our histological findings, like the cribriform aspects, where we will say, well, these patients should probably be really tested in a kind of regular manner. Biomarkers will play an increasing role, but biomarkers, be careful, biomarkers will not sort out everything. You always need a kind of comparison. The comparison is, of course, the initial tumor. We have a better understanding of the clonal evolution of prostate cancer, which, of course, will play a role in our reporting. And I also think that artificial intelligence will be something which will be more implemented and more important as well in daily practice, at least I hope so, as also with the biomarkers, so that some kind of biomarkers can be precisely be seen with artificial intelligence, and everybody will be able to read these kind of images. So this is my overview for the next 12 months, which might be a little bit optimistic.